गच्छामि ते सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठे गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदम् शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदम् शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदम् शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदम् शुभं कल्याणम् आरोग्यं धनसम्पदम् शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदम्
सर हंगे जाने ಮೇಡಮ್ ಜಾಯಿನ್
I welcome all of you to this press conference. I'm sure I'm not new to all of you, but infertility is also not new to you. But there's not a day that passes by without an item in the newspapers about infertility, about reproductive medicine, good or bad, but it is there, and it keeps reminding you, why is this so important when the country is so overpopulated? But my dear friends, I think infertility is propping its head up because the population is decreasing, and it's almost like 1.9 now, even in a country like India. So we have to sort of sit up and wonder, why is it decreasing? There may be many causes, as I see today, but every other day you see another new IVF center cropping up, but yet the claims are tall, 80% result, 90% result, and there is a misleading thing in the papers and the public get misled. Why do public get misled about infertility? It's only because they do not understand the mystery of infertility treatment. It's like not a baby shop where you're pregnant, and of course from the time you're pregnant, those 2 lines that you see, then from the 2nd month, 3rd month, 4th month, and then 9th month you deliver. It's fair enough. Or if you have a cardiac problem, then you put a stent, fine. Or you have a kidney problem and then you get a good success rate. But in infertility it's not the same, because you do a lot of treatment. I've seen many people coming with 4 and 5 failures and you get the same result. But yet the pockets are empty and the result is negative. So what makes Santana fertility very different from the rest of the infertility clinics? I mean, it started almost 40 years ago, and yet today we still stand as a beacon of hope to a lot of people. The reason being that it has standards. It has standards to say, first, what is wrong in infertility. Today, the country has a burden of 60 million people who are infertile. To treat that 60 million, there are only 5,000 doctors and 5,000 clinics, and of which you have only 500 clinics that are really doing full-fledged IVF, and the rest are all like small clinics which don't have the full IVF facilities. Now, to add to this burden, we really don't have standards. What is a pregnancy positive? Is it seeing a beta HCG positive? Is it seeing a sac in the uterus? Is it seeing a heartbeat? Is it seeing a live baby in the hand? We don't know because everyone says I'm giving you 80% result. Is it a beta HCG positive? So she goes with a beta HCG positive but has no baby in the hand. So is that called a success? Or is a pregnancy in the uterus but no pregnancy in the hand? Is that called a success? Or is a baby in the hand called a success? So there are many ways of saying success in IVF. Only when you have a baby in the hand, it's called success. So therefore, one has to define success in IVF. Now today, if I am going to say that with so many clinics already mushrooming, why does Santana fertility need to come up at this point of time, and that why does Dr. Kamini Rao need to come forward into it? I can give you many reasons. Now, are anybody looking at why do you have to do 5 IVF cycles to say that you go in for adoption? The answer is, my dear friends, look at why did the first IVF cycle fail. Rethink about the treatment, and that is where you come to the drawing board. Use AI in your system and try and find out where the mistake is. So, Santana fertility looks at economizing the cost of IVF by trying to treat the patient not just as a patient, but look at the problem as a whole. Don't look at it as soon as she walks in, don't corporatize the whole thing. Make sure each patient may come with infertility, but the cause may be different. So identify the cause. Unless you identify the cause, you will not know what the treatment would be. So each patient will have to be identified properly before you are able to give her the treatment. So there lies the problem. Identify the cause. I see many of the people who come to the clinic, because ours is a tertiary center, who have had many treatments of 5 cycles where the basic problem lies elsewhere. If the person has a thyroid problem or has some other problem and you're treating her with IVF, IVF is not the answer for infertility management. Treat the other problems and then you don't need IVF treatment, they just need correction elsewhere. And if the person has a sexual problem, IVF is not the answer, treat the sexual problem. If the sperm problem is a problem, then treat the sexual problem. So the idea is, do not use IVF indiscriminately. So if you are able to identify the cause of the problem, then your treatment with just a counseling can get you the results. So to say that IVF or infertility treatment is costly is a misnomer. So Santana stands for integrity, transparency and outcomes. So we want to be absolutely clear to the patient that counseling is important. So do not take people for granted. Santana also stands for giving results in the first cycle rather than to go on repeating like a trial and error. The other thing we want to do is research in genetics, HLA typing, to look at stem cells, for example, in cases where the person is azoospermic. We are able to look at getting fibroblasts and culturing them because they are pluripotent, and to be able to grow sperm cells for the same individual so that they don't have to go for donor sperms. We are trying to grow eggs for women who have lost the power of eggs in their ovary. We are looking at research of cutting edge so that we will have to do away with third-party reproduction. So genetics, research, cutting edge technology is what I am looking for in Santana fertility. Because these are the things that will set Santana apart from any other fertility unit in the country. And when we have stem cells, we may even look at taking scaffolding with stem cells, fibroblasts of the same woman and create artificial uterus and put it into women that don't have a uterus.
Good afternoon, dignitaries of the dais, Dr. Kamini, Dr. Vaishnavi, Dr. Prashant, and Mr. Nanjundaya. Partners and friends, this August gathering, and members of the media. It's not more than 24 hours from the time I spoke about a venture of mine, which was Magnet Hospitals. And one of the things I pegged on that was a partnership model, because I always believed if you want to go fast, you go alone. If you want to go far, you go together. And today is yet another example. We had one of a neurosurgeon yesterday and a pediatrician who spoke on why they're coming together to work with me, because in the last 3 decades, I think I spent a lot of time, or probably wasted time, creating value for only shareholders and investors and promoters. And I think the next 2 decades, I need to look at creating that for clinicians and nurses who are the backbone of the sector. One of the things Dr. Kamini Rao didn't mention is there are very few people who have got one of the highest civilian awards in India, which is the Padma Shri. We are fortunate that somebody of her stature has decided to join hands with me, though I've known her for a decade. She could have partnered with any one of the bigger brands. But I think what we got to know between each other is the shared common vision of what we want to do for the community. And beyond all that is to create the next legacy of clinicians who will take the Santana promise forward. Beyond herself and Dr. Vaishnavi, because among the 5,000 odd infertility specialists, probably maybe anywhere between 33 to 40% would have been trained under Dr. Kamini Rao. And maybe the balance 60% would have studied the book she has written. So either ways, they either been inspired by her mentorship and her education, or they would have been probably reading the books she's written for the future of infertility. And that probably forms the universe of the entire infertility community today. And the co-ownership model which I plan to take across to expand Santana, starting the city of Bangalore with about 12 centers. This currently we launch it with 5, which is in South Bangalore and one towards Electronic City, one in Central Bangalore, one in West and one in North. We further plan to expand that to about 12 centers, get the proof of concept, show outcomes, stand by the promise we make, and then see if we can take it to other cities. What we plan to do in this also is the same promise that we made yesterday at Magnet, that each one of these centers need to be headed by a nurse, and the nurse needs to understand the requirements that the clinician has and the patient has. They're the best to understand this at both ends, and then create a co-ownership model with clinicians on it. One of the cornerstones of the Santana program would also be looking at what's the future in infertility being done. For about 60 million people, that's about 30 million couples, 5,000 infertility specialists is a very disparity-based number. And democratization of infertility or democratization of healthcare cannot happen with one huge humongous center at one location. It can only happen with a co-ownership model where you work with doctors and create accessible centers within your own neighborhood. So the intent of this infertility centers on the partnership with Santana Fertility and Magnet is to get it closer to home, understand the psychology of the patient, and as Dr. Kamini Rao said, sometimes it must be just counseling and you don't have to go beyond that and abuse the system. And also try to understand the science behind it and move towards a direction, because from the first time test tube baby was born, Louis Brown, to the next one, which was in India, I think the period was about 6 months, somewhere in Calcutta, a child called Durga. And you heard my colleague Dr. Karthik talking about the numerous ones to Dr. Kamini Rao's credit and Dr. Vaishnavi. And I'm sure in this partnership model together, you will see many more first to the credit of the joint venture. Thank you so much.
Good afternoon. I've always been very much inspired by my mother, Padma Shri Dr. Kamini Rao, looking at the way she brings a lot of hope and joy to people's lives. So I never wanted to be anything else but a fertility specialist. The association between the Magnet Hospital and Santana is definitely going to make sense at multiple levels. Most importantly, it will democratize the IVF treatment or the fertility treatment for logistical reasons. As there are many centers of Magnet Hospital and it is distributed all over the city. So most of the time we see that patients are probably going to refuse to see a person because of the distance. So this is something which is going to be very much overcome. It will enable patients to access the state-of-art facility and also which would be very close to their homes, because as we know that it is located in 4 different zones, and also it will help for patients to receive and standardize the protocolized treatment. To travel to centers has become the major problem for most of us as well as the patients themselves. So to book appointments, to make consultations easy for people to seek these kind of fertility treatments. Due to shared infrastructure and central procurement, we also would understand that the cost factor also would be a little reduced. And also at Magnet hospitals, we are keen on maintaining the clinical autonomy of doctors and also giving them clinical equities to doctors and nurses. So as a daughter of 2 doctors and daughter-in-law of 2 doctors and a wife of a doctor as well, being surrounded by doctors, so it appeals to me very, and I get very emotional at this point of time, that the doctors and nurses are being given their dues in this particular organization. So Mr. Dinesh Madhavan's track record speaks a lot about how giving back to society means a lot to everyone. And also we are very happy to join hands with him and Magnet Hospitals. Thank you, sir. And that is why I think Magnet Hospitals and Santana, it really went a lot, into deep thought for me, that it is a match made in medical heaven. So I'm very happy at this point of time to reveal the logo of Santana Fertility.
ನಾನು ಇವಾಗ ಇನ್ಫರ್ಟಿಲಿಟಿ ಬಂದಿದ್ದನ್ನ ಚಿಕಿತ್ಸೆ ಮಾಡ್ತಾ ಇರೋದ್ರಿಂದ 40 ವರ್ಷ ಆಗಿದೆ. ಅದಕ್ಕೆ ಇದು ಹೊಸ ವಿಧಾನಗಳು ನಾವು ಶುರು ಮಾಡಬೇಕಾಗಿರೋದು ಈ ಸ್ಟೆಮ್ ಸೆಲ್ಸು, ಜೆನೆಟಿಕ್ಸು ಮತ್ತು ವಂಶವಾಹಿ ಕಾಯಿಲೆಗಳು, ಇನ್ನೂ ಹಲವಾರು ಕಾಯಿಲೆಗಳನ್ನ ನಾವು ಅದು ಕಂಡು ಬಂದು ಅದನ್ನು ಇನ್ನೊಂದು ಸಲ ಅದು ರಿಪೀಟ್ ಆ ಥರ ರಿಸರ್ಚ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದಕ್ಕೆ ಈ ಸಂತಾನ ಫರ್ಟಿಲಿಟಿ ಅಂತ ಇದು ಶುರು ಮಾಡಿದ್ರು ಡಾಕ್ಟರ್ ವೈಷ್ಣವಿ ರಾವ್, ಮೆಡಿಕಲ್ ಡೈರೆಕ್ಟರ್. ಅವರು ಇದನ್ನ ನಡೆಸ್ತಾ ಇದ್ದಾರೆ. ನಾನು ದಿನೇಶ್ ಮಾಧವನ್, ಮ್ಯಾನೇಜಿಂಗ್ ಡೈರೆಕ್ಟರ್, ಮ್ಯಾಗ್ನೆಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಜೊತೆಗೆ ಸೇರಿ ನಾವು ಇಟ್ಟು ಇದು ಶುರು ಮಾಡಿದ್ದೀವಿ.
ನಮ್ಮ 40 ವರ್ಷಗಳ ಸುದೀರ್ಘ ಈಗ ಯಾಕೆ ನೀವು
ನಾನು ಯಾವಾಗಲೂ ಹೊಸ ವಿಧಾನಗಳಿಗೆ ನಾನು ಯಾವಾಗಲೂ ಮುಂದೆನೇ ಇರ್ತೇನೆ. ಈಗ ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ಇದನ್ನು ಒಂದು ಸೇರಿಸಿದ್ದೀನಿ. ಸೊ ಇವಾಗಂತಂದ್ರೆ ನೀವು ನೋಡ್ತಾ ಇದ್ರೆ ನಾವು ಸಾಕಷ್ಟು ಹೊಸ ವಿಧಾನಗಳನ್ನು ಶುರು ಮಾಡಿದ್ದೀವಿ. ಇದನ್ನು ಒಂದು ಅದಕ್ಕೆ ಅಡ್ಡಿಷನ್ ಇದೆ.
ಇವತ್ತಿನ ಈ ಒತ್ತಡದ ಜೀವನದಲ್ಲಿ ಈ IT ಲೋಗೋ ಡೌನ್ ಮಾಡಿ ಅವರಿಗೆ ಫರ್ಟಿಲಿಟಿ ವಿಚಾರದಲ್ಲಿ ಒಂದು ಏಜ್ ಫ್ಯಾಕ್ಟರ್ ಜೊತೆಗೆ ವರ್ಕ್ ಲೋಗೋ ಡೌನ್ ತೊಂದರೆ ಆಗುತ್ತೆ.
ಸ್ಟ್ರೆಸ್ ಎಲ್ಲರಿಗೂ ಅಫೆಕ್ಟ್ ಆಗುತ್ತೆ. ಯಾಕಂದರೆ ಈ ಸ್ಟ್ರೆಸ್ ಅಂತ ಏನಿದೆ ಅದು ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಅಂತೇನಿಲ್ಲ. ಅದು ಸ್ಟ್ರೆಸ್ನಿಂದ ಮಧುಮೇಹ ಕಾಯಿಲೆ ಮತ್ತು ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಕಾಯಿಲೆ ಮತ್ತು ಈ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಮತ್ತು ಇದು ಬೊಜ್ಜು ಇವೆಲ್ಲನೂ ಸೇರಿಕೊಂಡು ಅದು ಬಂಜೆತನಕ್ಕೆ ಎಫೆಕ್ಟ್ ಆಗುತ್ತೆ.
ಇದು ಎಷ್ಟೋ ಕಪಲ್ಸ್ ತಮ್ಮ ಇದಕ್ಕೆ ಹಾಸ್ಪಿಟಲ್ಸ್ ಆವಾಗ ಕಪಲ್ಸ್ಗೆ ಏನು ನೀವು ಇದ್ರ ಬಗ್ಗೆ ವಿಚಾರಿಸ್ತೀರ? ಅಂದರೆ ಈಗ ನ್ಯೂ ಜನ್ರೇಷನಲ್ಲಿ ಫರ್ಟಿಲಿಟಿ ತಗೊಳ್ಬೇಕಾದ ಇನ್ಸ್ಟ್ರಕ್ಷನ್ಸ್ ಬಗ್ಗೆ ಏನು ಹೇಳ್ತಾರೆ ಅವ್ರಿಗೆ?
ಫಸ್ಟ್ ಅವರು ಫರ್ಟಿಲಿಟಿಗೆ ಅಂತ ಬಂದರೆ ಅವ್ರಿಗೆ ಫಸ್ಟು ಕಾರಣಗಳು ಗೊತ್ತಿದೆ. ಆ ಕಾರಣಗಳಲ್ಲಿ ಇವಾಗ ಅವರು ನಾರ್ಮಲ್ ಆಗಿ ಕನ್ಸೀವ್ ಆಗಬೇಕಾದ್ರೆ ಅವ್ರು ಬೊಜ್ಜಿದ್ರೆ ಅವ್ರಿಗೆ ಬೊಜ್ಜು ಕಮ್ಮಿ ಮಾಡಿ ಕಳಿಸ್ತೀವಿ, ಡಯಟಿಷನ್ ಹತ್ರ ಕಳಿಸ್ತೀವಿ. ಎರಡನೇದು ಏನು ಅಂದರೆ ಯೋಗ ಮತ್ತು ಕೌನ್ಸಿಲಿಂಗು ಮತ್ತು ಇದು ಡಯಾಬಿಟೀಸ್ ಕಂಟ್ರೋಲ್ ಮಾಡೋದು ಮತ್ತು ಫಿಸಿಷಿಯನ್ ಹತ್ರ ಕಳಿಸ್ಬಿಟ್ಟು ಹೈಪರ್ ಟೆನ್ಷನ್ನ ಕಮ್ಮಿ ಮಾಡಿ ವಾಕಿಂಗ್ ಮತ್ತು ಈ ಮೆಡಿಟೇಷನ್ ಇದೆಲ್ಲ ಕೆಲವು ಸಲ ಇದೆಲ್ಲ ಭಾಳ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಎಷ್ಟೋ ಜನ ಈ
ಒಂದು highest order ಇಂಡಿಯಾನಲ್ಲಿ ಫಾರ್ ದ ಮೆಡಿಕಲ್ ಫೀಲ್ಡ್ ಯು ಕ್ಯಾನ್ ಗೆಟ್ ಆಸ್ ಅನ್ ಇಂಡಿವಿಜುವಲ್ ಸಿಟಿಸನ್ ಪದ್ಮಶ್ರೀ ಆವಾಗಿಂದ almost 10 plus years we were in touch to understand how to improve science and the art of infertility. ಇವಾಗ ಡಿಸ್ಕಷನ್ ಆಗ್ತಾ ನಂತರ ಅವರೆಲ್ಲರೂ ಇದು ಸಿಂಗಲ್ ಸೆಂಟರ್ ಅಂತ ಮಲ್ಟಿಪಲ್ ಸೆಂಟರ್ಸ್ ಎಕ್ಸ್ಪ್ಯಾಂಡ್ ಮಾಡೋಕ್ಕಾಗತ್ತಾ ಇಲ್ಲ ಕ್ಯಾನ್ ವಿ ಡೂ ಕ್ಲಿನಿಕಲ್ ಕೋ ಈಕ್ವಿಟಿ ಮಾಡೆಲ್ and partner where I have education absolute clinical equity and you come in as a person from management. Since we have the same vision ಇಬ್ಬರು ಸೇರ್ಕೊಂಡ್ಬಿಟ್ಟು ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಒಂದು ಡಿಫ್ರೆನ್ಸ್ ಮಾಡಿಬಿಟ್ಟು ಇನ್ಫರ್ಟಿಲಿಟೀಸ್ ಅನ್ನು ಎಕ್ಸ್ಪ್ಯಾಂಡ್ ಮಾಡೋಕ್ಕಾಗುತ್ತೆ ಅಂದ್ಬಿಟ್ಟು ನಾವು ಒಂದು ಆಲ್ಮೋಸ್ಟ್ 6 months ಡಿಸ್ಕಸ್ ಮಾಡಿ ಫೈನಲಿ ವಿ ಟುಕ್ ಅ ಡಿಸಿಷನ್ ವೆನ್ ಐ ಸೆಟ್ ಅಪ್ ಮ್ಯಾಗ್ನೆಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ದಟ್ ಎಂಟೈರ್ ಇನ್ಫರ್ಟಿಲಿಟಿ ಹಾಸ್ಪಿಟಲ್ ದ ಇನ್ಫರ್ಟಿಲಿಟಿ ಬ್ರಾಂಚ್ ಇನ್ ಮ್ಯಾಗ್ನೆಟ್ ಹಾಸ್ಪಿಟಲ್ ವಿಲ್ ಬಿ ವಿತ್ ಸಂತಾನ
ಮತ್ತು ಮ್ಯಾಗ್ನೆಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ ಅಫೋರ್ಡಬಲ್ ಪ್ರೈಸ್ ಆಗಿರ್ಬೋದು ಬಟ್ ಡಿಫ್ರೆಂಟ್ ಅದರ್ ಕ್ಲಿನಿಕ್ಸ್ ಹೇಗೆ
ನಿನ್ನೆ ಪ್ರೆಸ್ ಮೀಟ್ನಲ್ಲಿ ನಾನು ಹೇಳಿದೆ ಮ್ಯಾಗ್ನೆಟ್ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ವಿ ಆರ್ ಸೆಟ್ಟಿಂಗ್ ಅಪ್ ಮ್ಯಾಗ್ನೆಟ್ ಫೌಂಡೇಶನ್ ಅದು ಅಶ್ವಿನಿ ಪುನೀತ್ ರಾಜ್ಕುಮಾರ್ ಜೊತೆಗೆ ಮಾತಾಡ್ಬಿಟ್ಟು ನೆನ್ನೆ ಐ ಡಿಸ್ಕಸ್ಡ್ ಆನ್ ಕ್ರಿಯೇಟಿಂಗ್ ದ ಮ್ಯಾಗ್ನೆಟ್ ಫೌಂಡೇಶನ್ ಅಂಡರ್ ದಟ್ ಅ ಚಾಪ್ಟರ್ called the Puneet Rajkumar chapter and offering almost 15 beds in Bangalore in phase 1 free treatment and 12 IVF patients free treatment, one every month in the first year. Hopefully based on grants which we get and support, since we are getting it into an ATG, I'll be able to do more. 1% of the hospital turnover and 1% of the proceeds we are giving towards IVF treatment for free of cost for couples who can't afford. Currently, fortunately, since it's been classified as a disease, it has got insurance coverage. But there are a lot of people in India from lower social economic class and afford ಮಾಡಕ್ಕಾಗಲ್ಲ ಅವ್ರಿಗೆ through the foundation support ಮಾಡ್ತೀವಿ.